Welcome to the European CME Forum podcast. European CME Forum is a not-for-profit organisation that promotes multi-channel discussion on matters relating to European and global CME CPD. Remember, this podcast is available as video on YouTube and Spotify. I'm Eugene Pozniak, founder and programme director of European CME Forum. So, welcome to part 2 of Thoughts from Europe, following the Alliance meeting in Atlanta in February. In recent years, more and more Europeans have been coming to the annual Alliance meeting, and we've managed to catch up and have conversations with the majority of them, as well as an Australian, to get their thoughts about the meeting. In part 1, we discussed everyone's first impressions and motivations for attending. In this episode, we explore the specific sessions that people found most impactful and useful in their own practice. We start with Katie Eustace of Answers in CME in the Netherlands and Celeste Kolanko of M3IME in the UK. Okay, so the tough question now. Out of all the other sessions, is there a key message that came alive for you that you thought, oh yeah, I've got to do this back in my office when I get home? I don't know, Katie, was there something that stood out for you?
So I wouldn't, so I'm going to approach the question just a little bit differently and just, mention one of the more impactful sessions, for me, a little bit of reiterating what we already understand, but also reiterating just the so many different flavors and varieties of the way that, supporters are looking at what we are providing in terms of an educational grant. So I attended the session, different global supporters and US supporters that were on a panel, Merck, BI, Lilly, I believe, Daiichi was on the panel as well. And where they really kind of discussed what they were looking for in terms of a grant submission. And obviously, it was so varied and so different across the panel. So it makes our jobs, very complex in terms of, being able to kind of ride that wave and understand the different needs. Also, I think we've all discussed this a little bit, but the multi-support challenges that we face as providers, the expectation from some organizations versus the non-expectation of others, and what that means in terms of us really, being able to implement those programs from a multi-support aspect. So in terms of European support, or in terms of more functional grant support in Europe versus out of the US or global, the preferred method hasn't necessarily been multi-support, but I do see that coming, to light more and more. And so it will challenge us as organizations, and those of us that are trying to implement good CME to ride that wave. So.
Yeah. No, that's great. Yeah, and I was in that session too. It was really fascinating to hear multiple pharma companies talking about how they support education, and I particularly remember actually one standout phrase for me.
Was it the AI comment?
The AI comment. I like that.
That's
Yes,
correct.
by all means, use AI as much. Yeah, make it more readable for us, make it easier. And it was all just positive, positive, positive. And then, of course, the obvious was then said, but heaven help you, if there's one hallucination in there, one reference that goes to the wrong place, you're not going to be getting funded by my company. That was the shortest takeaway that I had from that whole meeting.
Yeah. Yeah, I attended that as well, and yes, that did ring true, because that is always a discussion we're having constantly now, these days. How much input should we be? How much should we be using AI? And quite frankly, also, how much time does it really save us if it is still hallucinating and the like? Is it quite ready yet? So, but I think we're going to continue to hear that over and over again. So, something to be aware of. Yeah.
Sure. And was there another session, Celeste, that made an impact on you?
Yeah, I thought one of the more interesting sessions that of course, there were multiple sessions, and trying to choose which one to attend is always a bit of a challenge. But I think the one that sort of resonated the most with me was one on leveraging project agility. And I think my main takeaway from that is, it's becoming more and more challenging for us as we move on to create education that is relevant and stays relevant. When we get into some of these therapy areas, we launch, you get a grant signed, you work on developing something 2 to 3 months, anywhere 1, 2 to 3 months, depending on what it is. You put it out there, it's accredited for a year's time, but what happens, in the changing marketplace, in that meantime, in that 1 year space? So I thought it was quite interesting. And I'm not sure that I have a ton of specific takeaways for that, but it really did get me to thinking as we're doing our planning to really kind of look at the horizon, what's coming down the pike. Do we see, there's, some information going to be given out at one of the major congresses, 3 months after we launch? What are we going to do if something new comes out in that type of information? So kind of planning for more change in how rapidly science changes and what we can do to make that relevant, again, in our content. So as I said, there were some interesting exercises that we performed, as a group. But I think that one nugget for me was like, what does that planning look like? And how are we going to take any kind of changes that happen from the time we launch until the accreditation has expired? What are we going to do about that? How are we going to make sure that our content is correct and up to date and valuable?
Emily Harrison of Nexus Healthcare Education in the UK.
The one session that's really stuck with me since coming back home was actually the number to teach session. So this was looking at, whilst the whole Alliance had a huge focus on outcomes and no longer allowing us just to say, was it a good program, but what difference did it actually make? And what are we measuring as an outcome, but also our impact of the education, was this concept of the number to teach. So I don't know if you attended this session or not, or any of the listeners of this, but essentially the concept, and I don't know it as well as those that were delivering it or presenting on this, but it was essentially looking at how many learners do we need in an educational program for them to actually walk away with the core objective of what we tried to achieve. So it's taking from clinical trials where we look at the number to treat, so the number of patients needed for the drug to have the desired outcome, and a similar concept, and how many of them walked away from that program actually with our full objective in mind. So not just how many changed practice, how many, moved from their knowledge shift, or how many are now more competent in their practice themselves, but actually what was the overarching number, and sort of trying to, I guess, pull together an idea of what was that measure of impact. There were a lot of questions raised around what that then means for pulling together the number of learners we might need for funders to agree to fund programs for us in the future. And there's so many unknowns around that. But I just thought it was such an interesting concept now of trying to go back over your programs, look back over activities that were funded previously, and try and identify what that number to teach was. And see how you can make improvements for future programs. But it's a really interesting, novel, new concept. And I think that was a core theme throughout the whole Alliance. And what I've really taken as my key learning from it was that everybody involved in the industry of looking at continuous education for healthcare professionals is really focused on how we can innovate. And I'm not just talking, using AI in our programs or AI in our systems or creating efficiencies in those ways, but actually looking at how we can, find novel ways to reach our learners and make sure they are the right learner, find new ways to report on outcome data and what that impact has shown, different ways for accrediting content and that concept in itself. So it felt like everyone in the room was sort of at the forefront of trying to advance continuing education for the better, and trying to look at learnings from the past and what that means for the future.
Next, we hear from Ghione of Global Learning Collaborative in Spain.
Well, I think there was a great session. It was a global session, and I think that generated a lot of awareness about the fact that you cannot just create a US-focused program, educational program targeting US clinicians, and because you add subtitles, it's enough. So I really love those sessions and those debates, because it's really key, as you know, coming from the European space, that we need to focus on guidelines elsewhere in Asia Pacific, Latin America, and Europe, and talk about access issues and barriers into diagnosing and treating patients in different regions of the world. So I think for those who were very US focused, it opened their eyes to say, okay, we need to stop and pause, and we need to reshape how we design and form our programs to make sure they're truly global with these additional perspectives.
Daniela Clape of Xpeer in Spain.
What I really loved is the recurring topic around equity. So because it has always been one of my, let's say, personal mission in the CME to really make CME accessible to the vast majority of healthcare professionals. So what I really liked is in the US, it's really, again, a concept that is really central, in CME, and not that much in Europe. For example, in Europe, it's still very, let's say, accessible to very few healthcare professionals. So I really think that, yes, for me, it was a key concept that I kept, let's say, putting on my diary, like equity, and all the concept around it, not just the accessibility to the content for all the different, let's say, stakeholders, but also taking into account the minorities in the CME programs, etc. So it's more granular, everything. It's much more sophisticated CME, So basically, that was my key concept, I would say.
Phil McElnay of Medall in Ireland.
I mean, the one that I really loved was with the team at DKB Med, who were explaining some of the work they were doing in their Saving Sites program. And so we had Stan and the team from Regeneron. So had Karen, for instance, was talking about some of the outcomes. Samantha was sharing a little bit of the work that they'd done in supporting that project, and Rachel, who was presenting it on the DKB Med side, and it was really impressive. A reminder about why we do what we do, and they were talking about the use of education and, in some ways, embedding that education into clinical practice. And they provided the tools to the hospitals to help them do that with some technology, with cameras to help detect whether someone's at risk of vision loss, and took it to the next step. Right, so that it's really impressive work, because it's taking it. We talk a lot about do, right, bridging that gap between knowing something and doing something, and very rarely you see an example of a project, both from a supporter side and a provider side, where that is totally aligned, right? It's aligned on what's happening in the project, it's resourced effectively to do it, and then it's implemented and executed really well. And it was just a really great example of what you can do when you really put your mind to it, you resource properly, and you actually have the patient at the end in mind. So for me, that session, it was a Thursday session on Saving Sites. Really impressive work, really outcome orientated, and we're not talking post tests. We're talking how many people's sites were saved. That is exciting, right? Seeing that impact on a patient from the education that you're doing is exactly why we do this. And again, it was this, like, I don't know. Was there AI in those cameras? I have no idea. I didn't. We might have picked that up. They might have talked about that. I can't remember, but we weren't talking about how we use ChatGPT to educate people, right? We were talking about how do we save people's sites, and that requires much more than just a very simplistic view of education and the use of AI in education. It was talking about how we combine education with really amazing technology in a very clinical way to save someone's vision. And they screened like so many more people to save their sight. And they did that by telling clinicians what they needed to do via important education. Perhaps telling is not the right word, but educating clinicians in what they needed to do to save someone's sight, and then giving them the tools to do it.
Elspeth Headley and Caroline Halford of Springer Health Plus IME in the UK.
There were so many great sessions, and I think Caroline and I had to sort of divide and conquer our time between the two. So I let Caroline go to all the kind of AI focus sessions. I went to some of the more, I say traditional, that's probably the wrong word, the traditional kind of educational sessions. I went to lots around compliance, but one that stood out for me was a session evolving from outcomes to impact. It was led by Suzanne Murray, and it really questioned the terms outcomes and impact, which are used quite interchangeably, but are actually completely different things, and how, you know, it's relatively easy to find outcomes from an educational program, but how can you really show, define, and measure impact, long-term impact? It's much more difficult. And it ended up being a really sort of engaging, open discussion around that with some examples. And I just found that a really valuable session. And when I've come back and I noticed that we use those terms interchangeably, it's made me go, oh no, we shouldn't. It's this or it's that. And we really need to define things a bit more clearly. So yeah, a really, really valuable session on that for me.
Excellent. Interesting. Yeah. And how about you, Caroline?
So yeah, lots of great AI sessions for sure. But I must say the one that I actually got to the conference early for, because I wanted to get a front row seat, was the method to our madness, the strategy behind grant review. And it was moderated by Derek Warnick from Sanofi. And it had Riaz Baksamusa, Annette Schwintz, Bridget Azy, and Amanda Kaczerski. So like a big panel of funders there really going through what the grant review process looks like, what are their red flags, what are they looking for. That was a real standing room only session, and I thought the insights from that were great. Everything from the big picture stuff, as in, you know, the things that we all know are important, such as striving for multi-support, making sure that, you know, the needs assessment is holistic and complete, but to the more smaller details that are still really important about the information going into the portal, you know, in those boxes, really being clear, because often on the first pass, that's what the funders see at first pass. So don't neglect those little details. So it was a very lively session, lots of questions, but it was brilliant. It was the kind of feedback that I think all providers are grateful to receive, just to make sure that when we're working on these proposals, that there's we're providing what the funders are looking for in terms of format and content, and to make the process easy.
We hear from the team at Touch IME, Joel Turner in the UK, Sven Arviger in France, and Hannah Fisher in the UK.
Probably the biggest learning for me was the importance of creating outcomes reports that speak to kind of like a really broad audience. So as a global provider of CME, we're used to sort of talking about different settings, about different health systems, about different geographies. The kind of key point for me was around sort of making sure that data that comes out of the content is accessible for not only global audiences, but also the kind of the different, the commercial teams, the grants teams, the med affairs teams. It's making sure that the data that we create from those activities is actually tangible enough and tells a story. So the sessions I really enjoyed were about mixing qualitative insights into quantitative data, about how to present that in a sort of really exciting way, and bring it to life for the supporter. So, and probably the sort of thing that stuck with me the most is one of the supporters mentioned that outcomes reports can really, like, I think they use the words live or die by how they're presented and they're perceived internally. So it's kind of it's about making it as easy as possible for supporters to get the benefit of those results from those reports.
Right. And Sven, I saw you nodding away there. Yeah, what was your take on that? And maybe there are other sessions as well that spoke to you.
I mean, I was obviously went with a slightly different objective of trying to listen to specific areas which would give me insights in how to approach finding the funding for our programs. I think one of my favorite sessions was, I just made a note, a method to our madness. I think that was quite interesting, seeing all the different supporters talking about how they're structured, how they, if they do unsolicited versus RFP, what they're looking for. So that was extremely insightful for me. And I think the take-home message from that was every supporter is different. There's no standard formula that works. You really do need to spend the time there, digging in, have discussions, and with every single supporter to see how you can work best to find the funding.
Brilliant. And then, so then Hannah, so as a team actually turning up with all three of you having different roles and responsibilities there, then from a company perspective, it must have been really interesting.
Yeah, and it was great actually. Even with three of us, it felt like we needed to clone ourselves sometimes to get to all the sessions that we wanted to, but it gave us a really nice opportunity to take in as much of the meeting as we could. There were very few sessions that we were all in together. We were, really trying to get as much information as we could and learn as much as possible. And like the other two have mentioned, we all have a slightly different focus while we were all driving towards the same objectives. Our roles are all slightly different. So, and there were sessions that were great for all of us there. And then nice to come together and join the networking and the celebrations and chat to other people as well.
One of the things that I take home that I think was reinforced at the Alliance, but I've heard it also at other congresses, even over here in the European CME Forum. There's a much big onus on telling the story. Historically, it was more about the data and very dry outcomes. It's becoming critical to be able to tell that story in an engaging manner. And I think, as Joel said earlier, it's the make or break if that's going to be circulated internally on the supporter side. That came out in a number of different presentations that I participated in and also the discussions. And I think storytelling is one of the big things that we need to think about and focus on even more.
Katrina Ford of Peer Voice in the UK and Monica Ghidinelli of the AO Foundation in Switzerland.
For me, there was one particular session that I really found invaluable coming from the provider side. I learned so much. I think I probably took about 7 pages of notes during the session. I was scribbling furiously, and I think a lot of people in the room were from the provider side. That was the one, the method in our madness, where there was 5 grants managers from diverse companies discussing, what they look for in grant applications, what works well, what really annoys them, what we should do to improve our grant applications. And there was so many tips and tools taken from that session that I could bring back, practical things that I could bring back to our organization and implement immediately to make our grants applications more valuable for our support, but also more robust and more valuable as well.
Great. Yeah, no, that was a very popular session, and it was like standing room only, wasn't it?
Yeah, it was.
Yeah.
Monica, from my side, I have to say there were so many sessions in which it's difficult to pick one. But let's say that when you go to that meeting, there are many sessions that are really focusing on also on the side of management, right? So there were also sometimes sessions in which they were suggesting tools on how to manage the projects. And so I took that on and I'm like, I'm going to apply this when I go back to my practice. So it was more about Microsoft Teams or also other management tools, project management tools like Asana. But on the other side, there were also a lot of discussions about, AI, for example. And let's say the last year, it was more focusing on giving you practical tools on how to use AI. This year, the conversation was more, basically there were many discussions about, okay, just because we have this tool means that we have to use it, or is there a place where to use it? And that was very interesting also, knowing that many companies are now, for example, taking away Copilot because they didn't think about how to implement it. So they bought it. They say to the employees to use it. But if you don't have a plan to train your team, how are they going to use it? So that was also a take home that I got.
Yeah, certainly one of the key messages I was hearing loud and clear was, yes, you can use AI, but AI, it's not completely 100% verified all the time. It can hallucinate. So make sure a human is validating what is said. The grants managers in that session that I mentioned said, it's very obvious if somebody's used a reference from AI, and you won't get asked again if you do. So make sure you validate everything that's done in AI if you are going to use it, was loud and clear. But I think it's how far we've come with AI is just crazy in the few years. I remember in New Orleans at Alliance only a couple of years ago, nobody really was using AI. Nobody knew what to do with it. Everyone was a bit afraid of it. And now look at us. We're all using it every day in practice, and we're coming so far. So it's, it was really interesting sessions on that as well.
Yes. And also what I learned is that the ACCME, so the accreditor side from the US now has a clear regulation on how you have to disclose what you have to follow as a provider when you create this content. And that was, I was not aware. So it was very interesting that now also the creditors are jumping into how you have to use AI and how you have to disclose it.
We hear again from Ghione.
I think AI is evolutioning our industry. I think it's helping us be more powerful, effective, quick in disseminating clinical data. And it's very important. I think all of the sessions I attended, Eugene, it was all about how do we use these new tools to improve, be faster, more effective, but at the same time, be careful, watch out, right? Hallucination, there may be mistakes, there may be some guidance which is misleading. So that I think that people cannot fall into trap, companies cannot fall into the trap, the providers thinking, okay, with ChatGPT and what we have with generative AI, we can build all of our content, and we no longer need the internal resources like clinical strategists that I historically have been collaborating with my entire career. So I think it's important to, yes, move with the trend, to take advantage of all these new tools, but at the same time, be a little bit cautious and look at them with a set of eyes to make sure that everything that's coming out is absolutely accurate.
Well, yeah, no, it's certainly a message, that I kept hearing through the whole meeting. And it's good to have that reassurance, really, for us not to get too comfortable and to always look at AI critically, because, it doesn't always give the answer, however beautifully it may be presented.
And I think it is the future. I sat through sessions where you can see where pharma is developing patient cases and educational providers are as well. And the look in the feel is a little bit robotic right now, but it's kind of interesting and exciting for me to see the trends and to see the evolution, because I think everything is going to become more humanistic. It's going to become more natural as we evolve. So I'm excited to see how the future looks with these new tools.
Elspeth Headley and Caroline Halford again. What are your opinions on use of AI, and did you change your approaches as a result of this conference, or even just sort of thinking next few months out, how are you going to be approaching it within your own organization?
I think it was reassuring. I say that because with AI, you almost, or maybe it's just me, you almost think everyone else has solved it and cracked it, and maybe it's only us that are still trying a few things out. And actually you realize that's how everyone is kind of feeling, and we're just feeling our way, really. So it reassured me that the ways we're using it now are the correct ways. But also gave us some ideas as well, particularly around the outcomes piece, how we can get really good qualitative outcomes. We know we've got the data, the quantitative side of things. How can we incorporate AI perhaps to increase value on the qualitative analysis side? But I think overall it just maybe reassured me that we were using it in the right way, an ethical way. But also it was a lot of the sessions were quite provocative as well around how we could be using it in the future. So I loved listening into those discussions.
Yeah, I feel the same about the AI thing because yeah, it was nice. I think the overall message that I got from every session and every conversation was that, yeah, okay, no one thinks that it should replace, the human input, but more as a really nice complement to it, to either to either start you off or to give you extra nuances around the data that you're putting into it. So certainly on things like I think this came up on the grant review session is using it to double check needs assessments or proposals, certainly making sure that your outcomes reports align with the program that you set out to achieve. And even this was something that came up. I went to a really good session on podcasts and how to optimize making the best podcasts. And it was one of these workshop sessions where you had to work on your tables in groups. And I was in a group where each group had a separate challenge on making a podcast series on a specific topic. And one of the ladies on our table got her laptop out and was like, okay, let's use AI for this. So in each set of the challenge, for example, stage one was come up with a series of 5 podcasts on this particular topic, and what are the agenda points going to be, who you're going to get to host it. And AI was brilliant at coming up with catchy titles, a really nice structure. And of course, it's not the kind of thing that you just put into AI and leave, but it was brilliant. Our minds were working with AI to come up with some really good shortcuts that would have made a really good fictional podcast series. So that was a real eye opener for me to maybe, try it in different ways alongside the strategic scientific experts to make a product better.
Our editors at the Journal of CME, Lisa Sullivan in Australia and Robin Stevenson in Scotland, UK.
I would have to revert to Robin's comment about AI. I think that there was so much time spent on the topic and the discussion around the good, the bad, and the ugly. I think the take-home message for me was that although they perhaps haven't really recognized the existential threat, they are all very involved in recognizing that it's part of their daily life now, and they need to be working out the best ways to incorporate it so that they can make their own jobs better. That was the sort of message I got from all the AI sessions that I attended.
Well, as you know from our session, we made the suggestion that possibly in the future, the lives of commercial providers is going to change, perhaps not so much in the US, but certainly elsewhere, in that support from the industry is reducing and may continue to do so. And at the same time, we made the case for saying that hospital CME departments should be expanded, given that a lot of the problems in the future are going to appear to be related to physician performance deficiencies, particularly in the form of burnout. And that if burnout is going to become an ever-increasing problem, then it's going to have to be dealt with locally within the healthcare facilities. And that's going to mean collaboration between QI and with CME, and the development of perhaps larger departments better able to study physician performance than happens just now. And we were trying to suggest that may be one of the ways of the future. And perhaps commercial CME providers should think, would they fit better in the future into the hospital setting? Would they be accepted there? But in many ways, it's likely they would. They have special skills which are not easily found within the hospital setting just now. So I think from the future, that was the idea that I would quite like to play around with and talk quite a bit more.
But, Robin, you'd be interested, just today, a paper came across my desk, which was from the Kaiser Permanente, I think in California, where they actually have written a study around how they have combined their internal CME departments with their QI departments to in fact take EHR data and improve performance outcomes and so on. So, not focusing on disease state knowledge, but on performance issues and gaps. It's really interesting, and it just literally came across my desk today. So.
And our final comment comes from Elspeth Headley, courtesy of a hot mic.
Yeah, there was one I didn't really get to mention because it sort of didn't necessarily sort of fit the conversation, but the best one, was one about compliance. It was meant to be on compliance, and the alliance had screwed up and it had been cancelled and left on the agenda. And so we're all sat in the room with no presenters, and then it's Jan Schultz just said, "Oh, sod it, let's do a free space, safe space Q&A on compliance." So it was amazing because it was like the kind of therapy session that you always wanted to go. A supporter wanted to do this, could they? And someone else was like, a faculty has got this disclosure, and basically everyone sort of had their problems solved. It was brilliant in the end. And the thing was, that wasn't even in the agenda. So maybe that would have been an amazing answer to your question about what to bring into the ACEhp, some kind of Q&A safe space where we all have issues. So you can have that, but it wasn't recorded.
But thankfully it was. That final comment was from Elspeth Headley, who we heard with the 15 other Europeans and Australian with their thoughts about their key takeaways from the Alliance meeting that took place in Atlanta in February. In the next episode, we'll have clips from the interviews of what this group of global CME professionals think are the key lessons that should be enhanced or adopted in Europe. Thank you for listening, and join us next time as we explore all things CME CPD.